So the way that I think about young adults and substance use are, what can we do to reduce the risk of misuse in the future? And something that's been pretty clear and pretty well established in the literature is that the longer that you delay someone's onset of substance use, the less of a chance they have of developing a substance use disorder. So anything that we can do as the medical community to delay someone's initiation of a potentially addictive substance, especially when they have markers or criteria that could lead them vulnerable to a substance use disorder, I think is really important.
And speaking as a general dentist, I think the most effective way to handle that is just not to prescribe narcotics. I think that, again, there's very few non-surgical procedures done in dentistry that require narcotics in any way. So if we're gonna say limit this conversation to oral surgeons or people who place implants or whatever, I think the most important thing is you're gonna think through how many doses are actually needed. You're gonna limit the prescription to that, and you're gonna, very closely go over, it's one pill every 4 to 6 hours. It's not going to increase its efficacy by taking it in 2 hours or taking 2 or 3 of these at a time. It's designed to work in a specific way, and I think you just have to deliver the message.
I think compared to a lot of the other healthcare providers, that we might actually see patients on a more acute basis. I think when other professions talk about preventative care versus reactive care, I think, our society, when it comes to dentists, a lot of the fear and the cost associated with our field, patients don't come to us until the last minute. So because we see so many walk-ins and acute pain, growing up in a household where my father was an ER doc, it's the only other profession where I think that they might have a very equal ratio of walk-ins that might come in acute pain. And even amongst what I had learned from my stepfather, and this is back in the early 90s, about the emergency room, the overwhelming higher percentage in his from his perspective, the overwhelming emergency patient came in the emergency room for dental pain. And even in the emergency room, at that time, it was antibiotics and opioids, and then go see a dentist. So I think what might differentiate us from other medical professionals are that, we work with most adults and children. At any given time, somebody has 32 teeth, 32 different reasons why they might have pain. And if their eating habits and their lifestyle doesn't help with the possibility or the increased possibility that they might have acute pain in their mouth, there's a lot of reasons why people would fear us and need us, and why we would want to manage their pain in the most aggressive way. And I think, like I said before, that could be a part of why we were responsible for some of the crisis with the opioids.